Kyle, you mentioned that from the pharmacy provider perspective, you have to stock basically everything that's out there. Now, at some point in the future, that might get to be 15, 20 drugs instead of one. And so from looking ahead a little bit and realizing that we're just on the cusp of biosimilars in the United States marketplace, what do you see evolving with time?
Yeah, so I think as more and more get approved, and I think as the uptake continues to increase, I see it, and what I hope to see happen is that it will snowball a little bit. So, right, we know that we've got at least one product now, maybe two products where there's multiple, you've got three in the marketplace, and that's driving a completely different market than what we saw when the first one hit. So we're seeing lower prices, we're seeing, I think more importantly, we're seeing more uptake of the biosimilars. And so for me, I see as more and more come to market, I think it will become natural to move to these biosimilars, and it will become, you and I probably won't be having as many discussions around biosimilars, or again, at least that's my hope a number of years from now, is that it has become the norm, that it looks right. It looks more like the brand name to generic switch that even I know that as generics first came to the marketplace, it was similar, right? The thought was that nobody was 100% sure about this whole new marketplace and if it was really the same thing. I think we're seeing a repeat of that with biosimilars today. And so I think as more and more come to the marketplace, as it becomes more widely accepted, and I think as we get just more experience and more patient days with them, the European market, if I remember right, in one of the classes has millions of days of patient therapy with no difference. I think as we start to see that in the US marketplace, that's only going to accelerate the continued use. And again, as I said, I hope the continued competition in the marketplace. It will drive the manufacturers to have more and more entries. And as I use the kind of the snowballing reference, where as the uptake goes up, there's more reason for manufacturers to get into the space, and those continue to just build on one another.
Yeah, I have been in practice long enough to predate our state substitution law, sure, which is scary in itself. And I agree with how you said, with brand versus generic and kind of the natural fear and uncertainty. But in our environment right now, over 90% of our scripts are filled generically. So we've gone beyond that. It's accepted. It is for what it is in terms of very cost-efficient delivery of care. We're able to treat 10 times the number of patients, for example, with depression than we could with branded products for the same costs. And my hope is in the future we'll see something very similar with biosimilars.
Now, you bring up a good point as it relates to stocking multiple biosimilars on the shelves. Now, fortunately, most wholesalers through who these drugs are purchased allow for rapid fulfillment to that dispensing pharmacy. So it allows you to minimize keeping that drug on the shelf and allow for more just-in-time acquisition of that product. Now, for a first fill, that might prove problematic, but over time, there's a better understanding of what plan utilization may look like on a patient-by-patient basis and what that need might look like within your patient population. So pharmacies are better able to anticipate purchase requirements more appropriately, and so it allows for them to purchase drug that's going to be used for those independent biologics and biosimilars for patient utilization.